a draft plan, which we all discussed and did something on that. We also planned a webinar and were able to do that in December. And thanks to Jacinta, who has been supporting us, we're able to also do that. We will also introduce her. And today we are here because we want to have our second meeting and then also look at the work plan that we have. And let me thank Patricia and Mahmoudou for the good work that they are doing for the chapter. We formed a WhatsApp group, and within the shortest time, we have over 400 people on the WhatsApp group, and we are very happy. And we are expecting more people here. And after the meeting, we will also post the actions that we need to take on the WhatsApp platform. We want to see everybody on board here. So for today, as you can see on the agenda, the items are clearly spelled out. After my welcome, I would do an introduction to AfriHealth, because a lot of people are with AfriHealth, but they will say that don't know much about AfriHealth. So we'll talk about AfriHealth so that you will really understand and can really represent AfriHealth wherever you find yourself, whether in your country, among your professional groups in the institution. And you can talk about AfriHealth for others to also come and contribute to AfriHealth. We will introduce again to you the chapter leads and their support, and then we also introduce the country representatives. If we have gaps, we will get volunteers to also fill in those gaps. We would have our question time after my presentation, as I introduce the chapter, the country representatives and the chapter leads. We'll have a question time. Then we'll also present the work plan and get your comments on that, and we will do the closing. So that is what we have lined up for us today. Please feel free to contribute so that we can have the best for this chapter. So Winifred, permit me to share my slide. So that we can all appreciate what AfriHealth stands for and do. AfriHealth was established in 2016, and it is made up of various health professionals with vast experience. And so when we say various health professionals, we mean from
Georgina, your network, I think, is cutting. You have now disappeared. Hi, Georgina. Hi, Winfred. It seems Georgina has disappeared. Just give her a moment.
Hello, so sorry for that.
Welcome back. You can proceed.
All right. Thanks for understanding. So I would proceed since you've seen this slide, so people might have read. So on the continent, AfriHealth has around 700 members, that's the individual members, and 36 institutions who are part of AfriHealth. And this is, if you look on the Africa continent, where our membership is not strong, or we don't have membership, is in the north of Africa. And we are seriously working on that aspect also. AfriHealth has a governance structure. We are duly constituted as an organization, fully registered in Ghana under the laws of Ghana. We have our annual general meeting, which is made up of our members, and they are the highest decision-making body, so it's what they say that the governing council also works with. So the AGM elects the governing council and mandates them to run the organization. The governing council meets twice in a year, and so they have an executive committee that oversees the work that the secretariat does, and that is chaired by the president of AfriHealth. And we work with subcommittees which are made up of members of the organization. This is our vision. So if you've looked at the brochure that we shared with you, you should see our vision that we are pursuing excellence in health, education, research, and then service provision. And we want to be a leader when it comes to health professions training and research. AfriHealth works within 4 goals. Our first goal is that as an organization that is working towards improved healthcare for the continent, we want to be self-sustaining. Yes, we have grants that support us, but we also want to be able to depend on ourselves and not only on grants, so that even if we don't have grants, we can still function as an organization and relevant to make the impacts that we want to make on the continent. We also serve as a platform for knowledge generation, sharing, and learning for the continent and the various health professionals. We know AfriHealth has human resource challenge. Africa has human resource challenge. And so AfriHealth is also looking at how we can support in terms of the quantity and especially quality of the health workforce, and then also ensure that we have interprofessional education and collaborative practice in all that we do as health workers. The last one is we work to contribute towards quality of healthcare through research and promotion of evidence-based programming, so that it will be able to address the health challenges that the continent has. The activities that AfriHealth is involved in are research. So we conduct research, capacity building, we do capacity building. We also have interprofessional student exchange. So it's not about just us. Remember, we are looking at excellence in health professions education. So students are also covered by us. Then we do webinars. We have our annual symposium, and as you've noted, we are having the 6th annual symposium in Maputo from 1st to 3rd August. And we invite all of you to join. Then we also have communities of practice that we call the technical working group. You can find all these things on our website. So our technical working groups are 10. So when you go to our website, you can find them. And we expect that every AfriHealth member will belong to a technical working group. The projects and programs that we have as an organization, with our setup, we are mainly supported by the NIH grant, which is supporting our development in all the activities that we do, and then also supporting us to be able to provide professional skills to our health professionals and especially our members and other people on the continent. Our knowledge sharing platforms, the interprofessional student exchanges, and the other collaborative practice are supported by the program. We also have a program called STRIPE, which is strengthening interprofessional education in HIV and then COVID. And what this program seeks to do is to build capacity in pre-health service education, and then also in-service health professionals for them to be able to deliver quality HIV care and then COVID care as well. And we do this training in person and then also virtually, and then some are just online that you can also take without interacting with anybody. We are also involved in another project, which is looking at antimicrobial stewardship in a One Health concept that is about starting this month. We were also involved in developing some frameworks for assessing midwifery schools, pre-midwifery schools, so that we'll be able to build up their capacities in areas that they were lacking, so that they can be institutions of excellence. And we did that work with Chipago, and the work has ended. Currently, we are also involved in another research work. It's an implementation science work with Africa CDC. We are looking at the effectiveness of COVID-19 vaccines and how COVID-19 interrupted health services on the continent. We are doing it with Infectious Disease Institute of Makerere University. And currently we are in 13 countries. We're supposed to be in 14, but Africa CDC has attributed in 13 countries in the 5 regions of the continent. We have another project that we are also involved in called Project ECHO, and I'm sure a lot of you might have heard about Project ECHO, which is a community of practice. And AfriHealth is the first institution to do it in health professions education, because it's always been run in service delivery areas where we are using it to build the capacities of faculties in higher education. And currently we are piloting it in Stellenbosch University and UK7. but everybody is invited to join. And so we would also share the link with you on your platforms. It is done bi-weekly, and you can join, and also you can have the opportunity to share your experience. These are the partners that AfriHealth has been working with. Yes, since 2016, we've been able to make some achievements. And as I said, we are legally registered in Ghana, and we have a functional secretariat in Ghana. We've been able to secure funding to support the work that we are doing. We've also been able to carry out a multi-country research work on COVID, on pediatrics and pregnant women, which have gained global and regional attention and has affected some policies that are being implemented. We have our newsletter that we produce quarterly, and our 13th edition will come out very soon this month. Our annual symposium, which is a platform of learning and knowledge sharing, we've been doing it except for COVID. We've been running it since 2017. We also have small grants for our members. The first one was done last year. Work is ongoing, and the small grant is about $20,000 that we give for our members to do work to improve health professions education. The second one, we are reviewing the applications that we've received. It was widely circulated. Through our Stripe work, we've been able to train almost 14,000, that is as of last year, in how they can provide quality HIV and COVID care. And it's not just the professionals that have been trained, but also institutions that have been involved, 145 institutions, and those we've used as facilitators whom we've trained to do that work, 1,342. We have a functional LMS, and we have courses on it. We have English, French, and Portuguese for our Stripe. HIV and COVID, we have in these languages. We are also doing another COVID-19 course with Stanford University, and that one we have the French and English ready, and we are running the first cohort. We started this month with the first cohort. Other capacity building programs that AfriHealth has been doing include the leadership development program, which we've run 2 sessions and we're continuing next year. This year we did the evaluation, and we have a publication out of that. And I'm sure some of you might have been beneficiaries of that training program. We also run scientific training programs, and we've trained almost 500 people out of that. Our grants writing, during the symposium, we'll also be doing a workshop on grants writing, because that's another important area. And we've had the opportunity of linking our early career scientists with global scientists for them to listen to them and also mentor them. When it comes to membership of AfriHealth, our membership is open to individuals, institutions, and groups who support the vision, mission, and goals of AfriHealth. So we have our regular members, and the regular members are those from Africa. We have individuals and institutions. And then we have international members, individual and institutions. We also have students, and then affiliates. The affiliate is an honorary position which the governing council confers on people. What are some of the benefits? If you join AfriHealth, what are some of the benefits? It's saying that you can participate as a researcher. As I indicated to you, we've been conducting research, and we look for people to be involved. We look at the growth work that we are doing with Africa CDC and IDI. As our members who are involved, I must say that for the work that AfriHealth does, the secretariat, we have only 7 staff here. So we are not directly involved in the work. It's AfriHealth individual members or institutions that implement the programs of AfriHealth. So you can participate in AfriHealth as a researcher. That's why we've asked you to update or fill the membership form on the membership portal. And we expect every member, even existing members as the old members, to also complete that, so that if we have any work, we can look at your data, the database, look at your area of interest or your area of expertise, and we can reach out to you so that you can be involved in that. You can grow professionally because we are a platform of knowledge sharing and generation, and we also do capacity building as well. You can also get the opportunity of growing others because we do mentorship as part of our work. And so you can also offer yourself as a mentor and help others to grow. We have a lot of resources. If you go to our website, we have resources. You can also collaborate with others. At times, the work is collaborative. We have work that we did in the COVID work that we did. The research, it was a collaborative research. Currently, it's been extended to 10 countries and it's collaborative. So we bring others on board. So if you have any work that you want to do, you may be looking for other people to be involved. And so with AfriHealth, you can find collaborators. You can also network interprofessionally because it's not about you. Remember, AfriHealth, we stand for, our hallmark is interprofessional education and collaborative practice. So also linking up with other health professionals. We have experienced senior health professionals that you can also interact with. You can also make your voice heard. We have the AGM, you can talk there. We have the AfriHealth community where you can also use to share whatever you want to say. If an institution also joins AfriHealth, what I would like to say is that if an institution joins AfriHealth, the institutional membership covers everyone in the institution, especially in the colleges of health sciences. So the institution can also connect globally because they will get to know other institutions and they can work together, access best practice, educational and research opportunities. You can also broaden your exposure, expand knowledge internationally, staff and student development and interactions. The student exchange that we do, it's for our member institutions. So if you're not an AfriHealth member institution, you cannot be involved. You can visit our website and read more about the student exchange. The capacity programs that we've been doing, our Stripe work, all those involved are from our member institutions. So which means that that is the opportunity you can get. And as an institution also, there is also collaboration there for you. You can also collaborate with other institutions when you have to do the work. When it comes to our annual subscription, as we've posted on our platform, as the WhatsApp platform, individuals, if you don't belong to any institution, which is a member of AfriHealth and you stand alone, every year you pay $25 to AfriHealth. If you are an institution, you pay $500 yearly. For undergraduate students, when we talk about students, we mean undergraduate students. It is free for undergraduate students. So AfriHealth also seeks for more members. We are looking for partnerships as well. So if you want to link us up to any organization that wants to partner AfriHealth, of late we are getting a lot of organizations approaching us because we look at the spread of AfriHealth on the continent and our interprofessional nature. They think that they can partner with us. They are looking around, and so when they contact you, AfriHealth is ready for that. So thank you very much. This is my presentation to you, and I give you the opportunity to ask questions, please, about our presentation. You can also put your question in the chat box. And then also, I forgot to let you know that you are to put your names and where your institution and your country in the chat box. So please do that for us. We want to know where you are coming from. All right. Please feel free to ask your question. Is there any hand up? Wilfred, maybe you can check for me if there is any hand up.
Not yet. Colleagues, feel free to ask questions.
This is about AfriHealth. For details, you can go to our website. We have our work there, every information that you need. Okay, I see James. Yes, James, do you want to ask a question, please? Hello, James.
Hello?
Yeah, James Mwaba, please go ahead.
Are you able to hear me?
Yes, please.
Oh, yeah, thanks so much. My name is Mwaba James. Yes, no, my question is, assuming one register as an individual member of the program, and then next year, for example, 2024, the sponsor is held, for example, in Ghana, and then if one from Zambia who registered as an individual member wants to attend the sponsorship being held in Ghana, for example, 2024, is there any provision of this travel sponsorship of that kind, or how can that individual member can be helped for travel, in terms of travel fare?
All right. Thank you very much, James, for that. So let me respond to you. AfriHealth, this year, we decided that let's look for sponsorship, because for all other institutions, they look for sponsorship to be able to give that opportunity to people, such as their members who will be presenting their abstracts, who have their abstracts accepted. We went out, but I must tell you that as of now, we haven't had any sponsorship to that effect. So we will keep on looking for that. For the 2024 symposium, we want to start early so that this year we can send our sponsorship letters out. And once we get that, we'll be able to support people with that. Because for now, the money that we have, we rather invest it in the symposium. So if you look at the symposium fee, it is subsidized because AfriHealth is already paying part of taking certain aspects of that, of the running costs. And so that's why we need others to come in to support us in a way so that we can support our members who have their abstracts approved but cannot, especially those from low-income countries. James, are you okay with my response?
Yes, yeah, thanks so much. I'm okay with the responses. I've gotten the clarifications.
Right.
I asked that because I felt we looked at the benefits, individual benefits, if one become a successful member of the program in the near future. How can one benefit from the program? If I am in Zambia and the symposium is held in Zimbabwe, for example, and want to travel, after when I'm having maybe a travel fair challenge, now how can one benefit? So anyway, all in all, we've clarified. Thanks so much.
All right. So what I also want to say is that being a member of AfriHealth is not only financial. because there are a lot of opportunities that you can have being a member of AfriHealth. As I indicated, if you participate in research, you can see you are in the best position to say that if I participate in a research which is multi-country, what are the benefits to you as a researcher, as somebody in academics? What are the opportunities for you? So it is not only the monetary one's benefits that you get that it's the benefit, but we should look at all the other benefits. But there are other people who have also grown professionally. Other people have had elevations and other things because of what they've been doing. The opportunity AfriHealth has offered them as a platform for growth. And so we should look at all these things. Because already for all other institutions, a member, if it comes to conference, what the difference you pay for conference or even for a capacity building program is reduced fee. Mostly it's reduced fee. But as I said, we are working towards that because we know the challenges that we have as a continent, for especially those from low-income countries. Any other comments? Any other questions?
There were two questions in the chat. The first one was regarding to when will the grant writing workshop take place, and the other one, when are you giving response to people who submitted proposals for funding?
All right, so I think Unifred has posted for the grants writing, this one, it's the workshop that will take place during the symposium. So that is what we will do during the symposium. That's when we'll do the grants writing. Last year, there were some grants writing in persons in South Africa and Maputo, but this one is a opportunity for everybody attending the symposium. The small grants, we are working on the applications. We sent a message to you to explain to you how we had some delays because of we not getting responses from some of the reviewers. But fortunately for us, for now, we've got all reports from reviewers. We had to change some of the reviewers, and we have, so very soon you'll be hearing from us. All right. Any other, do we have any other comments? Otherwise, we move on to the next item. Okay. So can we move on to the next item if we don't have any? Okay, there is something in the chat. Let me see if it's a question. Okay. All right. So the one who asked on the small grants is okay with that. All right. So Winifred, we'll move on to the next item, is to introduce to you your chapter leads for the second time running. Our first meeting, we introduced them, and we want to introduce them again today to you. We want to see their faces. I hope, yes. So Professor Mahmoudou, Winifred, maybe you take the agenda off so that we can see their faces well. Take off the agenda, yes. So Professor Patricia, can we see your face? And then the face of Professor Mahmoudou? Yes. Professor Mahmoudou, we want to see your faces. Please, all other cameras off so that we can see our hard-working chapter leads. So I think you are in the best position to give us a little about your backgrounds, and especially I want us to just raise our hands for Patricia, who is our new professor, new elevated professor. So that is Patricia. So Prof. Mahmoud, please introduce yourself, and then Patricia will also do that. Okay, over to you. Prof. Mahmoud, you are muted, please.
Hello, I'm Professor Mahmoud Ismail. I'm full professor of surgical pathology and at the Faculty of Medicine, University Eduardo Mondlane in Maputo, where we will welcome you in next symposium in August. We are waiting for you and to welcome you. We will host this very important scientific events. We are so happy, and let me personally and on behalf of my Faculty of Medicine and University to greet and to congratulate our new professor here, the Professor Patricia. Congratulations, well done, well deserved, and this is a great gain for AfriHealth, for our chapter. And that's all. I'm very happy to be with you here now. Over to you, Patricia, maybe to introduce yourself, please. Thank you.
Thank you, Georgina, and thank you, Professor Mahmoud. Like indicated, I'm Patricia Katoa Mkwato. I'm a clinical nurse by background and nursing all along, but I have a PhD in medical education. From the University of Zambia School of Nursing Sciences, I'm the Dean for the School of Nursing Sciences. I also serve as the chairperson for the Nursing and Midwifery Council here in Zambia, and now working with Professor Mahmoud as the lead for Southern Africa AfriHealth chapter. And I have interacted with AfriHealth for now close to 5 years, and I was also privileged to be a fellow. I benefited from one of the trainings. So I'm a fellow of the James Hakim Leadership Program, where I graduated in 2020. Thank you so much for your kindness. We are grateful the way you came on board to join the WhatsApp group, and we are hoping that we are going to be as interactive as we can. As you heard from Georgina, that this is multidisciplinary, so there are obstetricians there, pediatricians, I have seen neonatology, people from the scientists of all kinds, the biomedical scientists, also some people who support us, statisticians, and so on. We even have people from the vet with the concept of One Health. Now we are working together. So welcome on board, and we hope we work well together. Each one's contribution is important. Thank you.
Thank you very much, Patricia Mahmoud, for the introduction. We are really blessed to have these two colleagues. And I must say that Prof. Mahmoud is also a governing council member of AfriHealth, and he's been a foundation governing council member. He was re-elected last year when we were in Harare to continue serving on the governing council. And Prof. Mahmoud, we hope to meet again in Maputo, and the Southern Africa chapter people will be very happy meeting you also in person. And now we move on to our next item on the agenda, that is the introduction of the regional representatives. So I will leave it to Patricia. As I indicated to you, last year, we started looking at that. And so if there are any gaps, we would all help fill that, hoping that those gaps, we have people from those countries here or people who know people from those countries also here. So over to you, Patricia. When you are done, I will then present on, just show the work that we would be expecting from the regional leads, the country representatives. Over.
Thank you again, Georgina. Let me just share here. I hope you are able to see my presentation. And I have seen a few colleagues, like we chatted on WhatsApp, that the Southern Africa chapter spans from South Africa, Eswatini, Mozambique, Zimbabwe, Zambia, Malawi, Angola, Lesotho. Hope I have not left out any. So this is the chapter representation. I saw a number of these colleagues, and after I call the names, I think we just also want to see the faces. So like we have been introduced, myself and Prof. Mahmoud, we are the chapter leads, but we have our colleague Jacinta. Jacinta also just submitted, it's a lot of activity in the Southern Africa chapter. She just submitted her PhD. She was very busy, but 2 weeks ago, she finally submitted. So she's on board with us. And we requested that she'll be the chapter secretary. So she's from the University of KwaZulu-Natal. Then from Botswana, I think I saw Kenere Moteled. I think this one you have to pronounce it. From Mozambique, I saw, have I seen, oh, there you are, nice, 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 welcome on board. Then we have Mr. Fameti Taelo from Mozambique. Is he in? I didn't see him. Wave from Namibia, we have Vestorina Nwoma. I think I saw Vestorina.
Yes, I'm present.
Oh, good to see you. So our rep from Namibia.
Thank you. Just a correction on my surname.
Yes.
It's Nuyoma,
okay,
A at the end.
Right. We can correct it and you can put it in full in the chat. Then from South Africa, Maureen Zikit, are you there?
I'm there, thank you.
Let's see your face, wave.
Unfortunately, I can't share my video.
Okay, no problem at all. Yeah, thank you. You're welcome on board. From Eswatini, Dr. Ruth Mkonta. Ruth, I didn't see Ruth. Are you there? Then from Zambia, Dr. Michael Chigunta.
I'm here, Prof, and congratulations to you.
Thank you, thank you. Welcome on board. You are responsible for all of us in Zambia. From Zimbabwe, I saw my esteemed professor, Professor Clara Haruzibishe. Please wave so that we get to see your face. If you can, that is. I saw Professor Clara, probably she has fallen off. Lesotho, we have Angelina Zangaza. Angelina. Did I see Angelina? I think I saw Angelina. Okay, welcome on board, Angelina. Angelina, we were together in the AfriHealth James Hakim leadership training. Then from Angola, I don't know whether he's around, Prof. Francisco. So here we also have to learn a bit of Portuguese. Obrigado. Prof, is he there? Probably not. Then from Malawi, the country representative is Professor Abigail Kazembe. As you may know, she's the immediate past president of AfriHealth. She will be supporting us from Malawi, but she's going to be assisted by Priska Kaunda. Colleagues, forgive me, I may not have captured the titles correctly for those which I may not be familiar with, but we are going to put now in our database, we are going to correct the names and even the titles. So these are the representatives from the different countries in Southern Africa. Hope we can work together. From here to Lesotho is a distance, and we are hoping that you are more familiar with the people there, and we can work together across the sub-region. Thank you so much. Over to you, Georgina.
Thank you very much, Patricia. And thank you very much, regional country representatives, for accepting to do this work. We're very happy. And I must say that when Professor Francisco was introduced to us by Professor Mahmoudou, we had a meeting with him, and he happily accepted to be the representative. AfriHealth didn't have any member in Angola, and he, from there, started working. He was going to tell others about AfriHealth so that they can come on board. And they even started putting together abstracts to submit. And I'm very sure they have their abstracts accepted, and we were going to see them in Maputo. Also, as I indicated to you, the work of AfriHealth is implemented by AfriHealth members. We were writing a grant, and we had to add Eswatini. And we reached out to Ruth, and she was the one that we worked on that with. So it's important that if we know you, you are a member, we have all your information, we know your area of expertise, we can count on you, or we can fall on you to connect us with other people in those areas that we are looking for. So we have about 6 responsibilities for our country representatives. Just look up the down one is in French. We had a meeting with our French counterparts for Central Africa, and we did a translation into French. So as country representatives, you will be supporting your leads in membership mobilization. We have a lot of health professionals on the continent. We have a lot of institutions. And so we want you to help us to reach out to them. You can bring them on board, or you can also recommend them to us, and then we can meet with them. At times, some of the people want to hear about AfriHealth, so we do presentations to them, and then with that, they understand and become members of AfriHealth. So that is what we'll be expecting you to do, either bring them on board, or if you want us to also reach out to them, you connect us and we can reach out to them, whether they are individuals or institutions. There are a lot of institutions. My slide, there was one of institutions. We don't have a lot of institutions as we expect. So we want to see more institutions in our countries being part of AfriHealth. Then also, we want to also see you participating in our programs, AfriHealth programs, and mobilizing your members to also participate. So we have webinars, we have symposium, our training programs and other work, so that you can also circulate it to other members for them to join. So when we post it on your platforms, you have other networks, you can also let people be aware and join. We have programs that are open, even if you're not a member, you can join, but others too are closed for only members. So you can still share that. and then also other local opportunities that Africans can also advertise on. You also help us with that. Maybe there is a conference, could be an international conference going on in your country. That is an opportunity for AfriHealth to exhibit or partake at a certain point. You can also let us know, and we can ask you to represent us, or also ask the other the chapter representatives to also join you as well. Then also identify number 4, identifying and recommending experts for capacity building activities and as potential local research project partners, as I indicated. At times you may not be the expert in that may not be your field, but you may know other people, and they can help us reach out to other people. Let me give an example of our probe work, the vaccine effectiveness that we are doing with Africa CDC. We have our members, so we reach out to our members in the other countries, and they connected us to other scientists, because AfriHealth had to bring people from all over the 5 regions. So our members led us to some other scientists there, and we brought them on board. And as they came on board, they've also become members of AfriHealth. So that is some of the things that you will be doing for us. So we'll fall on you as we fell on Ruth. Fortunately for her, that was her area of expertise or her field. But if she didn't, that wasn't her area, she would have led us to some other people. Then if there are any opportunities, identifying and recommending potential local research opportunities. It's not only to AfriHealth, we could be even to the chapter, something that the chapter can also be including. And the last one is representing AfriHealth at national level and influence policy. So at your national level, AfriHealth works with ministries of health. So there could be an opportunity, and we would want you to be there to represent AfriHealth, and then the policies that are being made or whatever activities are going on there, you can also represent AfriHealth over there. So even in Ghana, for instance, AfriHealth can be invited to a program, and then the fact that we are here does not mean will be the people to go there. We can get some other members from within Ghana to also go, depending on whatever the program is or the policy that is being discussed. So these are the few things that will be expected of the chapter representative. So if there is any question, please feel free to ask, and then we will go to the work plan. But that has been shared on the platform, so I'm sure people might have looked at it, and so discussing it shouldn't take a long time. Are there any questions from the chapter leads that I need to respond to, or the country representatives that I need to respond to? Okay. It seems there are no questions, so Patricia, if there are no questions, I can stop sharing and then you can share the program.
Yes, please. Thank you. This is the Southern Africa Regional Chapter 2023 Work Plan. We are in this is now the 3rd quarter. Hope we are going to kickstart some of these activities. Like we had shared on the WhatsApp page, I will not take long, then people can contribute. This is exactly like we shared on the WhatsApp page. From the small group that was there then, we thought some of the activities we should be undertaking. The first one is sensitization about the chapter, not just about the chapter, but also about AfriHealth. And some of the tasks that we can do to sensitize is to publish information of a chapter on AfriHealth website, on the social media, and you can publish anything that is of relevance to health professions, both practice, education, research, and otherwise. So if there's any training that is significant in terms of sharing best practices, research activities, success stories on what you are doing, could it be in mentorship, or presentations at conferences, there's a AfriHealth website, and there's also other fora that we can use for publicizing that information so that everyone just gets to know what is happening. So if there's something that is happening in Swatini, feel free to post on our page, feel free to invite others. So the actual writing on the web page, dedicated times on the web page, we thought we can be doing it every quarter, so 4 times in a year. We can have a bit of a caption from the Southern chapter, and the country reps, together with all of us here, will be responsible for undertaking that. Capacity building activities which were identified then, they are to do with research, but like I indicated on the page that these capacity building activities will not just be in research. These are the initial thoughts. Ethics training, which cuts across, grants writing. Now people are interested in manuscript writing. I know we're at different levels of our professional careers, and also writing proposals. And we are grateful now that we can sit like this. In the past, we couldn't, but we are there with people from Ghana, Zimbabwe in this short period of time, and we can share ideas. So there were other ideas: simulation, assessment, managing of the asphyxia, anything, all forms of practice that we can share, because here they are practitioners. We can also have such webinars, just 1 hour webinar to share those best practices. So please propose in the chat, even as I talk, some of the capacity building activities we can undertake. Then membership drive. We had thought of conducting a baseline survey to capture the institutions, the health professional education institutions in Southern Africa. And our country reps, now you can help us, like in Malawi, how many health professional institutions are there, so that we know. And then we start targeting now individual members. When we get an institutional member, we can easily target individual members. Or when we get an individual from an institution, then that becomes a link for us to contact with the institution. So we want to have actually baseline information about what we have in Southern Africa. Other membership drives that we thought of is to establish focal point persons, the country reps. You know, it started as the entire Africa, then it was thought, let's go into regions, and we went into regions, but we thought regions are also huge. Southern Africa is big, Eastern Africa is huge. So now we have country reps, and all that is to draw more members. So country representatives, we will have a task to start now drawing members to this our chapter. And there are a few dates that have been proposed here. We can agree, and you can see some names which were proposed. These are just proposals at that particular time, but you can still propose if you know any expert, or even yourself, where we're seated here is a group of experts, propose that I can facilitate a webinar on grants writing. So that's how these other names were initially proposed. Like Georgina indicated, in December, actually, we had our first webinar on ethics, healthcare ethics. And we had a good presentation. So that was one of the capacity building activities. But going forward, we can continue. Georgina, last the presentation, and the others are just meeting that we need to be meeting at least every quarter. But we also need to be active, having like mini symposium, you know. AfriHealth organizes the yearly continent-wide symposia. So we need to be holding our own mini symposia like in Southern Africa. So this year, we have an activity. We are going to Maputo in August. But come next year, we need to ensure that we have our own mini symposium here in Southern Africa before we get to go out there. Thank you, Georgina. That's the work plan.
Thank you very much, Patricia. So, colleagues, if you have any comments, we have one comment that's saying that Lesotho has 5 colleges of nursing, 1 National Health Training College, and 1 university. I think NHTC, AfriHealth, went with them in 2021 and 2022. And so we know them. We are also working with Scott College of Nursing. And so please, let's have the names. Fortunately, Angelina has the rep, and you give us their contacts. So please collate that and then share with your leads. All right, so Walter, you are welcome. Yes, indeed, our chapter is in good hands because there are people who have tasted AfriHealth and they want others to also come on board so they can also taste of that, and we can all contribute for a better Africa. All that we are doing, the end product is not ourselves. We are looking at the continent. Just recently, I was telling some people that when we say the people on the continent, we are inclusive. If we are able to improve health professions, education, and our research, our service delivery will improve. And when you fall sick, because we are all patients, you will get the best of care and you will see the better Africa. So a better Africa involves all of us. And so that is the ultimate and not ourselves. Any other question, or we are okay? So we'll be counting on you to get recommendations on the resource persons who can support with this one. All right, so I think that for now we are done with the items on the agenda. If there are any questions, please feel free to post or unmute, and let's hear from you before we close. I would, before, when we are closing, I will ask Prof. Mahmoud to give closing remarks and then we will close. But before we close, let's hear from you if you have any comments to make before we close, before Prof. Mahmoud gives us the closing remarks. Any comments from anybody? All right. So Prof. Mahmoud, please give us your closing remarks. Not forgetting Maputo, August 1st to 3rd. Over, Prof. Mahmoud.
Thank you very much, Madam Chair, Madam Georgina. It's really an honor and a pleasure to have you leading us and giving to us some good explanation of what is AfriHealth. I would emphasize that we are AfriHealth, all of us. The intention, as you can see in the map, where the activity of AfriHealth is gaining, is almost all Africa. If we just see that Angola, he will be on board. We are with the professor who we already invited. We are sure that shortly we will have him on board. So the idea to have the training courses, the research area, the inclusiveness of the students, and all different health professional area. In my point of view, it's an activity of advocacy and communications, gaining our own institutions in every country. The chapter has many countries. Professor Patricia presented the representatives, but we must have a nucleus, a core in each country to reply these fundamentals of Africa. In this sense, I would like to ask, to request to Madam Chair Georgina, if she can deliver her a presentation, because in short, it will be so useful to do a resume of what is AfriHealth. There we have numbers, we have the projects, we have the gains, we have the missions, and sometimes with very short but very clear message like this PowerPoint, it can help us. The idea is to reply in each country to other institutions, and as you can see, the memberships are individual but also institutional. I think if we are engaged in institutions, and in each country we have many institutions, not only faculties of health science, but we have many other institutions. We could maybe go to our objective. It's important to know and to make this kind of advocacy. I could listen here some colleagues of where are the grants? Where are, if we can participate in a symposium? Of course, this is a very good idea, but the sustainability of AfriHealth depends on the fees, but not all of that. We have partnership, and in some moments we cannot maybe assist, but the idea is to go on and to have this kind of sustainability. If we have our own universities, and the universities as some kind of project, we can share this. The advocacy to the Minister of the Health, to other stakeholders, to other members of society. And we was, for example, discussing in our own way in Maputo. We have only 3 weeks to our symposium, but we must be so aggressive in good sense to go to the media and to explain what is this AfriHealth, what we intend to do, what are the main objectives, how inclusive must be, how sustainability must be. I think it's good just coming to the first point. I request if Mr. Georgina Yebo can share to us this your methodic and very good presentation PowerPoint. And do not forget that we have many other material, the flyer of all symposium. This is my main recommendations, and let's work together. Each country must be especially someone who can present and mobilize our own institutions. Thank you very much. Over to you, Mrs. Georgina. Thank you.
Thank you very much, Professor Mamudu, for that. So I will share the slides with all of us, because it's for all of us as members, so that we can also present it wherever we are. So please expect that. We are very grateful to you, and all of you, we are very grateful to you for making time to be with us in our second meeting. And we hope that the next quarter, as 3 months from now, when we call you, you will attend. And then the other programs that are in line, you will fully participate in that. Enjoy your weekends. See you in Maputo. Bye.
Thank you. See you in Maputo.
You'll be welcome. Bye.
Thank you.
Thank you very much. Thank you.
Thank you. Bye.
Goodbye.
Bye. Thank you.
Bye, everybody.
Bye.